Welcome guys back to my channel Dr. Pharynx. Today I will listen about anatomical structure for respiratory system. I want to make a video about physiology of respiratory system, but should mention the anatomical structure before that. Let's start. The function of the respiratory system is gas exchange and humidifier the air. The organs of respiratory system consist of nose, pharynx, larynx, trachea, bronchi and their smaller branch, and the lungs. We will start one by one from nose to the lungs. Nose consists of nostrils. Air passes through them. Two holes in the nose. Nasal cavity divided by nasal septum. It has respiratory mucus rich of network vessels warm the air. Mucosa produced by mucous gland purify the air from bacteria, has enzyme destroy them. Concha greatly increase the surface area of mucus exposed to the air. You should know just the anatomical structure part of the nose, which has inferior, middle, superior concha turbinate in Latin. Anterior nares is two holes of the nose, and the tutor tube. This canal will connect to the middle ear, and hard soft palate divided the nasal cavity from the oral cavity. The pharynx, function commonly called the throat. The pharynx serves as common passageway for food and air. It has three portions. The superior portion is called nasopharynx, the middle one oropharynx, the inferior one laryngopharynx. It has also the auditory tube which drains the middle ear open into the nasopharynx. In this picture we can see the three portions: nasopharynx, oropharynx and laryngopharynx. Here we can see the auditory tube. Larynx or voice box is formed by 8 rigid hyaline cartilage, sponge shape of epiglottis. It has also the thyroid cartilage, which looks like shield, the largest of the hyaline cartilage, called the adamas apple, or in Arabic adam. Trachea structure. The trachea is fairly rigid because its walls are reinforced with C-shaped rings of hyaline cartilage. Cilia. The trachea is lined with ciliated mucosa, located opposite to the incoming air, as they propel mucosa loaded with dust particles and other debris away from the lungs, so they take rid of the foreign particles to the throat, where it can be swallowed or spit out. Main bronchi structure. The right and left main bronchi are formed by division of trachea. From division of trachea, making for us the main bronchi. Size. The right main bronchi is wider, shorter, and straighter than the left, because the right is bigger. Trachea. In this picture we can see the trachea. Thyroid cartilage called Adam apple. Trachea consists of cartilage made by hyaline cartilage, C-shaped, primary and secondary bronchi. It has location of carina. Lung tissue. The lungs. The fissure of each lung is divided into loops by fissure. The left lung has 2 loops. The right lung has 3 loops. Pleura. The surface of each lung consists of visceral pleura and parietal pleura. Pleura fluid is produced by pleural membrane, a slippery serous secretion which allows the lungs to glide easily over the thoracic wall during our breathing movements. Lungs consist of bronchioles. The smallest of the conducting passageway are the bronchioles. Alveoli duct. The terminal bronchioles lead to the respiratory zone structure. It's even smaller conduct that eventually terminate in alveoli or in air sacs. Respiratory zone. The respiratory zone which includes the respiratory bronchioles, alveoli duct, alveolar sacs, and alveoli. This is the only sign of gas exchange. That's why they call it the respiratory zone, because the gas exchange happen in the alveoli that rich of capillaries. The respiratory membrane. Wall structure of the alveoli composed of largely single thin layer to make it easily exchanging the gases through their membrane to the capillaries. Alveolar pores connecting the outpouring air sacs. If coming from one air sacs blocked or otherwise clogged by mucus, they will transport it to another air sacs. Alveolar macrophages, which like phagocytes to unwanted particles or bacteria or other one. Colloidal cells produce lipid fat molecule called surfactant, which coats the gas exposed alveolar surface, and it's very important in lung function. we finish our lesson about anatomical structure of respiratory system. I know it's boring, we know this information, but I should make this video and explain them before making another one about physiology of respiratory system. Hope you enjoy. Thank you for watching.